the White House COVID-19 data director, tweeted today that 70% of U.S. adults are now at least partially vaccinated, calling it a milestone in the effort to combat the pandemic. But the Delta variant is fueling a surge throughout the country, with Dr. Fauci warning things are going to get worse. The daily average of new U.S. cases is over 72,000, up 532% since mid-June. And we're once again seeing long lines to get tested, this one in hard-hit Florida. Meanwhile, Louisiana is reporting the highest infection rate in the country, with hospitalizations there up nearly 500% from last month. Janae Norman has the latest.
Delta variant cases spiking. In Chicago, hundreds of thousands of concertgoers crammed into Grant Park this weekend for Lollapalooza. Officials say 90% of attendees were vaccinated, but now they're monitoring for any possible COVID spread as the U.S. marks a troubling new milestone, recording more than 100,000 new COVID cases in a single day for the first time since February.
We keep saying over and over again, the solution to this is get vaccinated.
47 states and territories now categorized as areas with high or substantial community transmission. At the Children's Hospital in New Orleans, they went from 0 COVID patients at the beginning of the week to 20 by Thursday.
In our PICU, we have a 23-month-old infant on a high-frequency oscillating ventilator. We've had 4 other teenagers, all unvaccinated, in the unit.
George spoke to Dr. Francis Collins, the director of the National Institute of Health, earlier this morning.
We heard Dr. Fauci say yesterday on This Week that things are going to get worse before they get better, but he doesn't think that lockdowns are going to be needed. How do you see the fall playing out?
We want to avoid lockdowns at all costs, but that means we're going to have to do some other things that won't necessarily be welcomed by people, such as the new recommendation of wearing masks in indoor gatherings, even if you're vaccinated.
And our thanks to Janae Norman in New Orleans. All right, let's bring in epidemiologist and professor of infectious diseases at University of Florida, Dr. Kartik Cherabuti. Doctor, we are seeing more than 100,000 new cases in a single day now, right here in the U.S., and for the first time since February, actually. And Dr. Fauci, as you heard, has warned that things are going to get worse. So how bad can we expect things to get? And when can we expect the Delta variant to actually peak?
What we're seeing now starts to already feel like the worst in Florida. Our hospitals are full. Almost all hospitals that I'm talking to, colleagues, they're full. They're at capacity. They're beyond capacity in some cases. So it feels like we've hit that spot. But if we don't do anything different, I think it's continuing to worsen, like Dr. Fauci said. What's the most immediate thing we can do? We know vaccinations are extremely important, but they take time. Right? You cannot give someone the vaccine now and expect it to halt the surge. We have to take protective measures, and that includes wearing a mask indoors and using ventilation strategies where opening windows, eating outdoors should be emphasized. We are seeing a problem both in the community and in the hospital. As far as when we hit the peak of the curve, we're getting to the peak of the curve, but it's very hard to predict that. We're learning from trying to predict this in previous times. We've got it wrong. So I don't think we can predict when the peak achieves, but we've seen a rapid drop off from the peak, and that does occur in the UK, in India, and other places with the Delta variant.
All right, so keeping that in mind, the good news is that the U.S. vaccination rate is actually picking up. Nearly a month after 4th of July, the U.S. has finally hit President Biden's vaccine milestone, as you know, of 70% of adults ages 18 and up having at least one shot. And the White House telling us that just yesterday was the 5th consecutive day with more than 700,000 doses administered. So could this actually help us get out of the woods? And how many more Americans do you think need to be vaccinated for case numbers actually to start dropping?
We've seen with Delta variant, you need the second dose. I think this is greatly reassuring. The 70% of people who got the first dose, a lot of them, a vast majority of them will get the second dose as well. So we know that in 3 to 4 weeks from now, we're in a good place, right? That's how long it takes for that immunity to build up. The second dose is really necessary to fight off Delta. So we're getting there, and these are very promising numbers. But we have some ways to go to make it come down. I think we'll see a combination of infections spreading through communities and having some resistance to the infection. with the boost from the vaccines adding up. I think that's the combination that's going to work. We just need more and more people to come in, at least get that first dose that might prevent you from getting severely ill. So we need to get another 5-10% in for the first dose and then keep the 70-odd% for the second dose as well.
You mentioned getting ill. You know, there's a growing concern about kids getting more seriously ill from the virus, as well as a rise of another respiratory virus in addition to COVID. Do schools need to start rethinking plans to fully reopen? What's your opinion?
My opinion here is the biggest challenge. We concentrate on kids. We think about hospitalizations, right? That's happening, and we're seeing that to some extent. But the real concern is the long COVID. We're seeing that not only in adults, and it's been covered in adults, but we're seeing that in kids. We're seeing things like hair fall as long-term symptoms. We're seeing things like heart rate shooting up in kids as a symptom of long COVID, some fatigue. And unfortunately, kids are not great at expressing what they're feeling. And we are looking at this as a mixed picture where we feel like they're just depressed. But no, they could very well be having long-term COVID symptoms. And we've seen that in the UK. We have to take that seriously. I think we need to take a step back, look at our policies in schools, improve the ventilation. I know my kid will be masked up going to school. I strongly encourage everyone else to have their kids masked up. Let's get through these 4 weeks. Kids are resilient. We forget that. My kid does a better job of wearing the mask than I do. Get through these 4 weeks with our kids, and I think we'll do a good job in schools.
My kids as well. You know, Israel is offering booster shots, and the UK is going to start in September. So it's just a matter of time before the FDA authorizes booster shots here in the U.S., right?
I think so. I think there are groups of people we'll start with. I think we'll start with patients who have transplants done, people who are immunosuppressed, the elderly. Israel has started with the elderly. But I think these groups need to be looked at just like we did with the first dose of vaccine. That's, I think, how we will do the third dose as well. Phase them in. Immunocompromised people, the elderly, healthcare workers. I think we'll see that same sequence play on with the booster shots. But we do need this to be looked in very clearly. It can't be the companies. It has to come from the government and a clear mandate on how to use those booster shots. But soon, I agree. Pretty soon, we'll see.
Good. Well, before we go, I want to ask you about the patients that you treat and that you treat daily. As we've heard, a large majority of people hospitalized are unvaccinated, and we know that vaccine misinformation has contributed to that. What do you think is the biggest piece of misinformation out there right now that you'd like to clear up for us?
I think the biggest misinformation we see that this is like the flu. 99% of people recover without any issue. I think that's probably the biggest misinformation that's out there. When we talk to these individuals, when we have one-on-one conversations, it's almost always regret and having not got the right amount of information. It's too late then, and it's hard to get them to talk to their own families and community members and let them know, because they see it as in some way failing by getting admitted. No, it's not failing. That's what hospitals are for. That's where we are here to take care of you. But it's not one where only 1% of people get severely ill or have long COVID. These numbers are the biggest misinformation out there. And I hope we can recognize that this is a serious illness. We treat it seriously, get vaccinated, use ventilation, wear a mask indoors. We can get over this too. I think this will see this peak drop pretty rapidly, but in a few weeks from now.
Dr. Kartik Cherabhuti, appreciate your time today. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.